A thoracostomy is a small incision of the chest wall, with maintenance of the opening for drainage. Rib spreaders are inserted into the wound and the ribs are spread apart, exposing the lung. Thoracostomy, with rib resection for empyema. Using a scalpel, an incision is made through the skin of the chest and the incision is deepened to expose a portion of a rib. To enter the chest cavity, a short segment of the exposed rib is removed using rib cutters. The resulting defect in the chest wall allows for the continuous release of pus from the empyema. Thoracostomy, with open flap drainage for empyema. To create a drainage site, a short segment of the rib is removed using rib cutters. The resulting defect in the chest wall allows for the continuous release of pus from the empyema. To ensure that the drainage wound stays open, a flap is created in the skin and subcutaneous tissues. Thoracotomy, with diagnostic biopsy, IES, of lung infiltrate, e.g., wedge, incisional, unilateral. Thoracotomy, with diagnostic biopsy, IES, of lung nodule, or mass, e.g., wedge, incisional, unilateral. Thoracotomy, with biopsy, IES, of pleura. Using a scalpel, the skin between two ribs is incised and the tissues separated to expose the inside of the chest cavity. A sample of tissue is removed using a biopsy needle or by cutting with a scalpel or scissors. The surgical wound created is closed by suturing. Thoracotomy, with exploration. Using a scalpel, the surgeon makes a long incision around the side of the chest between two of the ribs. The incision is carried through all the tissue layers into the chest cavity. Tissue can be sampled by using a biopsy needle or by grasping tissue and cutting it with a scalpel or scissors. Incision is closed in layers of sutures. Thoracotomy, with control of traumatic hemorrhage and / or repair of lung tear. The site of the injury is identified and repaired. Thoracotomy, for postoperative complications. With open intrapleural pneumonolysis. Thoracotomy, with cyst, removal, includes pleural procedure when performed. The lung cyst is located and removed by sharp and blunt dissection of the tissues. Thoracotomy, with resection plication of bully, includes any pleural procedure when performed. The lung bully is located and removed by sharp and blunt dissection of the tissues and often by folding and suturing of the tissues, plication.